Hello, today we will speak about joints, operational processes with joint issues and prostheses, and other related topics. Joints are connected, as we all know, with cartilages. Over time, these cartilages become more run down. Accordingly, in any of the joints, there is a cartilage. Let's discuss the joints and cartilages that go through the most pressure in the body. As a person ages and grows old, their cartilages also wither, and so the older the person is, the older the cartilage, which starts to fray. Not only is this related to aging of a person, but it may be because of physical trauma experienced in the past, like birth defects, as well as metabolic diseases and rheumatism, and so on. Every disease from the past will lead to fraying of cartilages and joints. At the start of the treatment, we start the conservative treatment, physiotherapy, thorough investigation of how the cartilages connect with the joints, and potentially other disturbances. After all of the examinations and uncovering of the causes, we give the course for a prosthesis. A prosthesis is an artificial joint. It could be made from metal and ceramic components. In the standard deterioration, there are no such issues. But when those patients come, you need to be more wary. This patient has gone through osteopathy. As you can see here, when the patient was 50 years old, we already installed the prosthesis in them. This is how you can observe the top snapshots. There is a hip curvature. We need osteopathy and a very good plan of the work. Before the prosthesis installation surgery, it needs to be carefully prepared and thought out. In other words, the axis of it must survive. The preliminary plan is very important to end with a good result. After the left side prosthetic surgery, this patient was fitted with the classical standard prosthesis. The right side of the hip we begin to see a twist. Out of the osteopathy, we must straighten the axis, rotate the hip downwards, so there is symmetry. As there is a narrow bone marrow is behind the hip bone, there needs to be a special type of prosthesis. And we, after looking at the results, we draw up a clear operation plan. After they create the plan of operating procedures, using a severe loosening, we cut off the tip. Using the same technique, we take the hip bone, we return to the original position and install the prosthesis. There were preliminary snapshots. This one, however, is after 3 years. As you can see, the joint has fully come into its place. The limb disappeared and there are no other problems. And through this entire period, as the patient walked around with this joint, they were also going through physiotherapy. Always we were trying to strengthen their hip bone because they were not using it for many years. So this is one very small but important detail after the operation period. In the period of 3 years, as you can see, no problems arose. Sometimes there are cases like this. This is also one of our suffering patients with obesity. There were 4 surgeries performed on him. Once, as you can see in the top glued part, the adhesive substance lasted and managed to swim out to the side. The lower part of the prosthesis broke and turned a little bit. Due to this, the patient once again could not walk. And at the top of the scan, as you can see, there is severe damage of the bone. Right at this point, there also needs to be a clear plan of procedures. This prosthesis must be taken out, then cleaned from the adhesive, and just as I showed you, if there is a bone rotation, it also must be solved. Here we decided to use allograft. There is the post-surgery scans. Here we used a prosthetic model. Cleaned the adhesive substance, restored the hip, and placed a long system model to install the allograft. There are the literal photos during the operation. These fragments that we took from the leg of the patient, like here, look, the leftovers of the adhesive substance that we took out. I've shown you the preliminary photos and the post-surgical ones as well. Of course, I want to say not all the entering patients are in such a bad state. Those are extreme cases. That is what we call them. There are also standard, lighter case. In a standard situation, nothing is too difficult. As seen in the photo, a standard case, if there is no need for adhesive, we must create a filling of the hip bone. We observe a femoral anteversion and between them there must be an alignment from 15 to 20 millimeters. If this is done without the adhesive substance, we use a press fit. We need to correctly measure them. Another important factor, you need to measure the length correctly. I will repeat, if you plan to not use an adhesive substance, then very importantly, you must use press fit. This is very important for the hip bone. And so, I will again tell you why you use adhesive substance and why you can choose not to. We look at the state of the joints. For example, if the hip bone is in normal condition, then during the operation, we'll decide to not use adhesive. Many say that an adhesive prosthesis has no problems for several years, but in my view, I do not agree with this. If the state of the bone is not very great, potentially related to arthritic diseases, then it could be a cause of rheumatoid arthritis. With this in mind, there will need to be a systematic treatment. It is very favorable for the doctor to be very familiar with the instruments used in surgery. The type or design of the prosthesis does not matter. Unlike the instruments you will use and the instruments you are used to, I usually recommend ceramic hydrocypatic prostheses. They are adhesive-free because I consider them better than others. That is my personal point of view. I still use ceramic somatic prostheses, though I only recommend this option to younger patients. As when the patient walks with these prostheses, it may cause some sound. I have experienced this in my practice. This is why I recommend polytemic ceramics. I had a situation where the ceramic prosthesis broke, but this is very rare for the ceramic prosthesis to break. To repeat myself, I experienced and witnessed this is only one of my patients. In work counseling the hip, everything depends on your habits and what you're most used to. You must know it's the literal tool you will use during the operation. The best option is not opposing the tools you are used to. I always approach this literally starting from the beginning, concretely investigating everything and getting to work. And no matter how many prosthesis devices I have implanted by now, I've never had it dislocate or slide. At the end of the operation, I will thoroughly, firmly and securely stitch the glute in its place. Only then I will close it. On the next day, after the operation, I will have the patient go through physiotherapy. I also want to discuss knees and knee joints with you. I want to say that we go through very effective surgeries on knees. As you may know, knees and hip bone prostheses must be good so that patients are still satisfied. If expressed correctly, knee surgery is not bone but cartilage surgery. In a knee surgery, the most important is to protect the connection. Unlike a hip surgery, the curvature of the knee must absolutely be corrected. In knee surgery, the curvature of the axis may need several resections, but you need to really try to avoid this. For these ill people, you could use a revised prosthesis. Here's an extreme case. As you can see on this snapshot, in the intersection the cartilage has stayed. It has been worn out, likely against itself. We observed a severe curvature. For these patients, a preliminary plan of action is very important. This patient has been ill a while and has not walked properly in a long time, so we need to correct the intersection and straighten under high pressure in the ideal direction. Here are some more literal shots. I say adults and elderly around the age of 70 to 75. As one of the knees is done, you need to do the second straight after, as a person with a healthy knee puts more pressure on the other, so it deforms even more. With age, strength becomes limiting, so over time this begins to bother the patient. Here are our post-surgery scans. As you've seen the preliminary snapshots, you can see that the literal curvature of the knee is straight. As it goes for knee prostheses, I first straighten the curvature if it's there. If it curves forward, I place the prosthesis on the back side. If the patient is in tile, then I must use a systematic prosthesis. Before the surgery, I must compose a graphic of axis length and go through all the necessary measures that all the actions are straight and correct. Again, for patients in their 70s, I recommend a dual-side prosthesis, not on one side, precisely both sides. If they're not too old, you can install a one-sided. In 6 weeks, you may do the second prosthesis. That is if the patient is younger than 70. After 60 years of age, the period after the surgery, the next day after the surgery, I start to check resistance. Over time, I introduce crutches. You cannot start walking immediately. Consistent training is a must. This happens very gradually. After the adhesive substance dries, everything will secure hold. I observed all of this carefully. Following these steps, you may bit by bit begin movement to feel it out. However, when it comes to the hip bone, I try to not use adhesive, unlike the knees where I always do. Through my experience with the different patients that come to me, I've come to a conclusion that it's best to use adhesive when we are concerning knee surgery. I will again say that any damage to the hip or the knee could be caused through childhood trauma, from birth defects to rheumatism. There are important factors to consider, but there isn't much difference between them during surgery. If at a young age there is a leg curvature, then this illness can be prevented preemptively. The time to place in some sort of measure, as to not wait for an adult age and the last moment. Recently, in this area, we're successful, and things are going great. No one raises issues. I'm sure that with time we will have more, even better methods of treatment for hips, knees, and all connections in the human body. At this moment, unfortunately, these are our only available methods. Currently, we only have prostheses. They remove unnecessary problems from a person and return them to the past way of life. At this moment, I believe that this is the best solution for these issues.